Hello everyone, my name is Damaris and I am the CEO and co-founder of EdMe Nursing Tutoring. Today we're going to be talking about the difference between bulimia nervosa and anorexia nervosa. Subscribe, like, share, and comment and let us know if this is helpful. Now, I want to preface by saying that there is two different types of anorexias. You have anorexia nervosa and anorexia. What's the difference? Anorexia nervosa is the mental health disorder where the client has control over their decision, whereas anorexia without the nervosa is a client who has a lack of appetite due to some kind of medical or physical condition, whether that be a medication or a disease process. Something is preventing them from wanting to eat, but it doesn't mean that they don't want to eat. They want to eat, they just don't have the appetite. So anorexia nervosa, this is the mental health anorexia. So what is the difference between the two? Biggest tip I want to tell you guys is that anorexia nervosa only has purging. Bulimia has binge purge. What does that mean? Binging is excessive consumption of something. And in this case, it's food for bulimics. Whereas anorexics, they don't have binging because they are severely restricting intake. Okay, so they are purposefully starving themselves because they want to maintain a certain body figure. In both cases, they want to maintain control. But in the anorexic side of things, they feel like they have to maintain control. So they go on these rigorous exercise regimens, these rituals. They only eat certain portion sizes of certain foods. They only drink a certain amount of liquid a day. They're constantly obsessing over how much weight they have. They are on a very strict diet and they don't deviate. And they'll be in the workout, they'll be working out for 4 hours straight, nonstop, to try to maintain a physique that they think is appropriate. And usually their BMI is severely low, okay? So it's usually below 17 in these clients. And they really think that they are fat, even though their BMI is below 17. They have body image disturbance, okay? Whereas in your bulimics, they have the binge purge, and that's typically a secret thing, right? So because of that, they are hiding the fact that they are eating. So they're still getting their regular consumption of food, but they're having purging episodes such as laxatives, self-induced vomiting, diuretics, excessive exercising, etc. So a lot of times bulimics get away with being bulimic because it's done in secret. But the biggest problem with the bulimics is that they still have some of these electrolyte imbalances and things like that. They usually have bad breath, or they'll have dental erosion from the self-induced vomiting. All right, and they can still go into these electrolyte imbalances because of the diuretics or the laxatives that they're using, right? So their BMI will typically be normal or sometimes overweight because of the excessive calorie intake during the binging. All right, so in their case, they feel like they lose control and they feel ashamed about it. Whereas anorexia, they are trying to gain control that they lost. So they control their diet through exercise and severe restrictions of fluid and food intake. So here it is. Big study tip again. Bulimic binge purge is present. Anorexia only purge is present. All right. They'll usually have lanugo, bradycardia, hypothermia, amenorrhea, which is a big key sign, as well as the lanugo. They'll have osteoporosis. They show signs of perfectionism, very key signs of anorexic. Whereas your bulimics, they usually have what they call Russell signs, like a calloused knuckle. Dental erosion is a huge giveaway, as well as parotid gland swellings. They also will have some shame and guilt around their body as well. So they also have body image disturbances, but again, normal BMI, nothing different there, right? So here is the difference between the two. Let's go through it again. Anorexia, control. Bulimics, loss of control. Anorexia, purge. Bulimics, binge purge. Anorexia, low BMI. Bulimics, normal to overweight BMI. Anorexic, severe fluid and food intake. Bulimics, excessive consumption in secret. All right. I hope this was helpful. Subscribe, like, share for more, and I hope to see you guys in the next video.